My name is Dr. Mohsen Soofian. I'm a family medicine specialist.
Hello everyone, gentlemen, this one's for you. We are here today in Hortman Clinics welcoming Dr. Mohsen Sufian from the US, doctor in osteopathy and family medicine. Today I think we have a great chance and an opportunity to talk a little bit about men's health and some other good things that Dr. Mohsen is bringing on the table to Hortman Clinics. First of all, thank you for joining Hortman Clinics. We are very happy and proud to have you on board. And also, congratulations, if I may say so, because in the past 1 month, I have heard not one time the care or the amazing feedback that the patients have shared regarding your practice. So, welcome, thank you. And I'm looking forward to learn as much as possible from you today, so we can send a right message to all the men out there.
Thank you for having me, and very happy to hear the positive feedback. That's what I live for. That's what I got into medicine for, to touch people's lives and put them on a good direction for a better tomorrow and better health. Health is wealth. What can I say?
Great. If just to warm up a little bit, I was thinking to ask you, what makes you amazing, or what makes you special, or what makes you different when it comes to medical care or to excellent care in terms of your patients?
Sure. Yeah, that's a great question. I always come back to excellent patient care. My focus is the patient. What are their needs? Taking a deep dive, finding out what's important to them. What are their symptoms? What are they suffering from? And really getting to the root cause. So everything is focused on excellent patient care. When we formulate our treatment plan, when we sit down and talk with the patient, I want to get to know who they are, where are they from, what is their life like at home, what is their life like at work, what are the stresses they're facing. And from there we're able to build a plan. But really, I do truly love and care for my patients, and it does come from the heart. I think you can see that from the patient's responses.
Sounds great. Thank you so much. One of your main area of expertise, or the main topic that you want to address at Hortman, and a hot topic, I would say, although at many points or many stages it's a taboo subject, it's men's health. What you can tell us in general, first of all, about men's health, and what are the tricks or the know-how that you possess that can help all the men out there?
Sure, absolutely. Men's health, it's a not very talked about subject. As we know, females have their own doctor, the OBGYNs, and women have very specialized needs. But men also have specialized needs, but they don't really know who to talk to or where to go. And I started going into that place because I had patients asking me, hey, what do I do for erectile dysfunction? What do I do for, other kinds of difficulties? And they were struggling. They were suffering in silence. They would, bottle it up. They keep it within themselves. And there's a lot of shame associated with some of these medical conditions that men, like I said, suffer in silence. So I empathize with these patients and wanted to find the solution for them. And there are powerful tools that we have. So there is no reason to suffer alone or think there's no solution or take dangerous supplements. There are many things a qualified healthcare practitioner who knows what he's doing and does care about his patient can do to dramatically improve the patient's life and quality of life and satisfaction with their life once on medication.
That's great. One of the questions that comes to my mind is that if you would have to define like 3 main pillars of one's men activity or men rituals or habits that can lead to best performance, productivity, and in general stamina and the well-being, a feeling of well-being and confidence. Can you name 3 main pillars for that?
I think for men are also, as we mentioned before, men are also part of the challenges that men deal with, men's mental health and depression. And a lot of that, I would like to encourage men to look within themselves and find out their purpose. What is their purpose? The Japanese have a philosophy called ikigai, which I believe loosely is finding one's purpose in life. And when you have that purpose, it gives men direction, and men need direction for where they're going in life and what they want to do with their career, their family, and what their overall purpose in this world is. Having that, I think, is incredibly important for a man's well-being, because men need purpose, men need to challenge, men need overcoming those challenges. And that is everything about a man's life is a challenge. You want a good body, got to go to the gym. You want you want to be successful, you got to have a good job, good career, be an entrepreneur, go somewhere with that. Part of being a well-rounded man is having leadership in all different aspects of life. So I do find men, I do challenge men to find that purpose, to help with that sense of mental well-being. Along those lines, we were talking about exercising. You got to go to the gym. Exercise is extremely important. Mental well-being, the physical well-being, the release of stress. Your mood is better. Your testosterone goes up after a workout. You sleep better. Your blood pressure goes down after a workout. All positive outcomes for your body and mental well-being are linked to working out. So incorporating that, and I know people are busy. I know it's we're here in Dubai. People working long hours. It's hot outside. They got a lot of things on their agenda they have to get done. But people can make room for taking care of themselves. Your body is the most important thing you have, and it's irreplaceable. I like to make the analogy that your body is like a Ferrari. If you take care of a Ferrari and maintain it well and pay attention to it, don't abuse it, do the regular maintenance and ongoing taking care of it, it will last you a lifetime. But if you don't take care of that Ferrari and something that is nagging or bothering the machine, and it is overheating or having some sort of maintenance failure, it will blow, it will explode, it will malfunction, and that will be extremely expensive. And that could be in a human being, that could be a stroke, a heart attack, obesity leading to diabetes, getting a foot ulcer and having an amputation. These are all things that for the most part can be prevented, and we should do everything to prevent it. So if guys, I do encourage them to look at themselves, and guys know if they're not in good health. You can look at yourself in the mirror and you can say, hey, am I in good health or not? If you're in good health. And if you're not, you need to do something about it. So I do encourage you, make this the time to look at yourself. We're getting close to the end of the year, make a New Year's resolution and get set for living healthy, putting away bad habits, and taking care of yourself. So that was two. The third one. Talking about what things can guys do?
I wanted also maybe to cover a little bit of a sensitive subject when it comes to men health or men confidence, yes. Manhood, sexual life, and what kind of details related to that can lead to a healthy and confident man, or on the other hand can lead to depression, or as you mentioned before, the feeling of shame, or any other less good feelings, if we can call them that way.
Frankly put, we'll discuss it as erectile dysfunction, but under the erectile difficulties category can be other things. Men should know that erectile dysfunction is common. It could be a physiologic problem, where you have a physical problem of your male genitalia from not being able to perform correctly, or it could be psychological, performance anxiety. You're in a stressful position. A lot of times, guys also, unfortunately, they're using alcohol or other substances that they shouldn't be doing that can cause problems. Should sexual activity be taking place? So for you to know, if you dial in your, if you're avoiding your alcohol, avoiding your cigarettes, taking care of your body, you'll prime your body to be able to perform well. But also knowing that as men age, after age 30, your testosterone decreases. Some estimates say up to 1% a year. So over time, as we get closer to andropause, which is the medical terminology for decreased testosterone in men, over time testosterone will go down. But unlike women all of a sudden, once they hit menopause, boom, it goes from 100% estrogen to 1% estrogen. Men, on the other hand, it's opposite. It's over many years. So the decay and the damage is done over many years. So guys get used to it. Oh, hey, I'm 50 and I've had this problem for many years and I never learned to address it, or I never addressed it, or I thought it was normal. If your body is not functioning the way it should be, no, it's not normal. And you should talk to your physician about it, because it's not just a physical problem, but it's also a mental well-being problem. As we talked about, there's a lot of guilt and shame associated with it, and there's a lot of negative connotations. Oh, he's not a man. Oh, he has this problem, and there's a lot of criticism given to men, and it is something out of their own control. It is just a biologic process that may be taking place with age, with some other things that are going on in their life, or psychological stressors. If you're stressed, you're not going to be able to perform. So a lot of shame is put on men, and again, they're ridiculed and laughed at by society, unfortunately. So you got to be able to talk to your doctor. I do encourage all men to reach out. There are things a good caring doctor can do for you to improve your health and improve your performance in all aspects of life. I do want to remind men that you only have one life to live, and you owe it to yourself to take care of your body, to find answers to the medical problems you may be having, and to live brilliantly, because you only have one life to live, but if you live it right, one life is enough.
Amazing. Thank you so much for sharing. So basically there is hope.
Absolutely.
There is hope, there are
Absolutely.
solutions, there are well-known treatment plans or activities that can be conducted within the clinic facility, that by seeing you or by seeing a good practitioner,
Yes,
that can help all of these points, right?
Yes, absolutely. And again, because this is going to be put online, I can't talk in detail about certain things, just for the sensitivity of the topic at hand. But I would say for most problems that men face when it comes to in the bedroom, there are answers and there are solutions, and we can make you back to the man that you always wanted to be, or that you were. I always remember I had a patient back when I was in San Diego, and he came to me crying with tears in his eyes because he said he was afraid his wife was going to leave him, because he said, I can't perform, I can't satisfy her. And he had everything, erectile dysfunction, other things, and the psychological stress on him. He was with tears in his eyes. His eyes were red from crying in my waiting room. We did a full assessment on him, did full labs. I talked with him, found out that yes, there's definitely psychological stressors, but also erectile dysfunction was playing a part in this, his symptomology. And we put him on the right medication. It wasn't just one medication, it was a couple medications, and I gave him the positive encouragement. Hey, I want you to work hard to know that there is hope, and that you're not alone, and that we're here for you, and give him that good positive support that he needed. We made a follow-up appointment for him for next week. I see him on my list yesterday. I'm excited to see him. I hope things are going well. And I see him back in my office, and his eyes are full of tears. And I was thinking to myself, great, what happened? I hope we fix it. I hope that nothing too bad happened. And when I talked with him, he started crying tears of joy, that he was so happy that we had fixed his solution, that his wife was happy as well, and that he didn't have those problems of erectile dysfunction that he used to have anymore. And he left with a huge smile on his face, and I will never forget that encounter with that patient. Just him the tremendous amount of good that we can do when you have a patient that is motivated and a doctor that truly cares about fixing his patient's life. We can make true magic happen.
That's amazing. I love that story. Thank you so much for
Absolutely.
sharing. I know there are few areas that you are performing as well. Probably will not be able to cover them all today. However, I wanted to ask you about the hormonal replacement therapy and most precisely the TRN for men, which is the most common one, and what kind of other like small introduction or information you can share to our audience that will help them, first of all, to understand what's possible, and second of all, maybe to invite them to have a conversation with you face to face here in the Hortman clinics.
So yes, TRT, testosterone replacement therapy, is the treatment modality we use for hypogonadism, which is hormonal decline in men over time. We have two options. It's injectable testosterone and topical testosterone. For some men who prefer, hey, I don't want to deal with the needle and I would like something that I could take every single day for better testosterone levels in their blood, we can apply a cream either on their shoulders, on their thighs. They put once a day, every single day, and that is an option. For other men who want more, who if we need to give higher doses, or if we need to, if we're not getting the correct blood levels, because sometimes that can be a problem, or if they have, for example, a partner that they're like a wife that may be touching their shoulders or touching other parts of their body, or young children that they don't want that gel to get on, then we may opt for a injectable testosterone. So we have different options, and of course, we definitely want to invite patients to come discuss with us, because it's not just, oh, hey, you want testosterone, here you go, never see you again. No, we need you to come in and we do a full blood analysis. Find out where your testosterone levels are. Find out, are you experiencing symptoms of hypogonadism, feeling tired, lack of energy, poor sleep, lack of libido, difficulties with having and maintaining erections, muscle loss, and depression. Guys, if you're low in testosterone, you're going to be depressed. You will be moody. There's the stereotype of the old grumpy man. Why is there so many old grumpy men? Because they may be suffering from low testosterone. So these are things that we look for to quantify that, hey, the patient is having what appears to be the symptoms of low testosterone. We draw your blood levels, make sure we also check for PSA, which is your prostate-specific antigen. It is a marker that we check for to make sure that there's no underlying prostate cancer. And once all your levels look within the range that we are expecting for someone that should be on this therapy, then we can proceed with the therapy. I like to meet with them in the beginning every 1 month to 2 weeks, just to optimize and really get the dose correct. I like to have that close monitoring of my patients to make sure that we're putting them on the right plan and they're getting the right results.
Sounds amazing. Thank you so much. One other point that I wanted to cover is the fact that here in Hormone Clinics we have a home service, and also we can offer some IV therapy drips, both in the clinic and at home. If you can tell us a little bit more about some of the benefits for IV therapy, and also what kind of service we can provide at home for our busy man or busy
Yes.
woman for that matter.
Yes, absolutely. The IV therapies that we have many different cocktails and blends of formulas for our IV therapy. The great part of IV therapy is that, if you're, say for example, you just got back from a flight, you're kind of feeling not too good, or you had a lot of partying, this is Dubai, had a lot of partying, your stomach doesn't feel too good, we can give you an IV. So it bypasses the liver, bypasses the stomach, goes right in your bloodstream and right where it needs to be. So it has 100% bioavailability. Anytime you eat anything, you cannot get 100% bioavailability. It's always going to be some fraction of it, because sometimes it goes to anything that's absorbed in the gut goes to the liver and gets broken down, gets processed, may not be fully available for use. But once you have IV, you have 100% bioavailability, and some compounds and some nutrients, some vitamins or minerals are not well absorbed in the stomach. Iron is one of them. Notorious that it's poorly absorbed, and that it also causes gut problems, causing maybe constipation, upset stomach. Once we give anything through the IV, you avoid all that, and it goes right to where it needs to be. We have our NAD IV that's great for professionals, someone who is trying to prepare for a sports event. Athletes love it. Anyone that is a professional that is in a high stress job where they're working long hours and maybe they're having difficulty with brain fog or focus. And also after a flight or before a flight, if you want to optimize yourself for a long flight, or if you're coming in and you're tired and maybe feeling a little bit sick or down under the weather after a long flight, definitely a IV would be a great option to get you back in the game, get you ready to go for tomorrow.
Thank you so much. I think we all had a lot of great insights of your know-how and what you loved to do. There is one more point that I would like you to address it when it comes to the osteopathy. So I think that that's a great advantage that you possess through this know-how. So if you can tell us a little bit more about this practice of yours and who can benefit, who is the candidate or the patient that can benefit of this know-how of yours.
Yes, sure. So I'm a osteopathic physician. In the U.S., we have two kinds of doctors. 80% are MDs, your traditional medical doctor, and 20% are DOs, Doctor of Osteopathic Medicine. We can do everything an MD does, but we also offer other manipulations using our hands to work on the spine, work on the musculature of the body, to improve physical function and biomechanics. So I do encourage everyone to try osteopathic manipulative therapy. We often like to use our hands to prevent using medication and not to be ready to jump right to a medication. So if you have any back pain, any sore muscles, sprains, strains, I'm really eager to get have my hands available and use them to find where's the problem. If we have to massage it out or do some soft tissue therapy on there. I really do enjoy providing that therapy for my patient, because patients, they're like, hey doc, I don't want just a pill. Spend some time with me and let's figure out what the problem is. So I really do enjoy using osteopathic manipulative therapy. And I believe I'm one of only 5 or there are very few DOs in the entire Emirates, so we're glad to bring this medicine from the US here. So you probably have heard of osteopaths over here. They typically work just doing that manipulative therapy on the body, but I'm a physician and an osteopath. So we're using the best of both worlds to enhance and elevate our patients' lives.
Amazing. And just before we close this great conversation, and thank you for that one more time, I want to highlight one of the cases that you had in the past 2 weeks that I really loved. So basically the patient came in for doing some blood work, doing some checkups, general routine, and then you observe some kind of skin condition that afterwards you recommend the patient to the dermatologist just to make sure there is nothing dangerous over there or nothing that the patient should be concerned about. So what I would like to highlight here is your attention to details and your willingness to go for the extra mile to look a little bit further than just your expertise, and also of course to take advantage of the multitude of specialties that we have here in Hormone clinics, and of course if needed to cross-refer the patient for further checkups.
Yes, absolutely. That was a very exciting patient. He's a busy professional here in Dubai. He came in, just wanted to do some very standard lab work, but we had an open conversation. Hey, what are you here for? You know, what are your goals of treatment? Oh, you want to look at this? Well, you know what? I see what you're trying to check with that. Let's go ahead and check some other labs that are related to that. So we built a plan for his labs, and he's like, oh, you know, I haven't done these in a while, and we developed a good treatment plan for him. I also noticed that he had many moles on his body, many spots that were hyperpigmented. With melanin, which is the substance that gives our skin color. So I have my dermatoscope, and I went ahead and I started examining him. And again, many of them there were so many of them because it was just part of his genetic makeup that he had these hyperpigmentations. But there was one spot that was a little suspect. And the beauty of working at Hormone clinics, we have excellent other specialties, including dermatologists. So I called over one of my dermatologist colleagues, and she also did a skin exam, and that spot that she saw, she said that this is a little bit suspicious, so they went ahead and took it out. So this gentleman who came in here, not knowing, what he was. Oh, I just wanted to come in for some lab work, but we ended up opening a conversation that, hey, let's do more for you. Let's do a full comprehensive checkup for you because we know you're busy. We know you don't have time to go do this another time. So let's take care of you now. And we caught something that could have been cancerous. So he was very happy, and it was a great pleasure to do that because skin cancer, especially where it was on his body, it was on his shoulder, in between his shoulders, someplace that he can't see, that no one can really see unless they're looking for it. So had this been not addressed and not taken care of, God forbid, could have turned to something very bad, which would be a horrible outcome for something that could be prevented.
Amazing. Well, I guess that's pretty much it. I want to salute all our people that watching from their home. Thank you to all our patients, the people that follow us on Instagram, on other social media platform. I want to thank Dr. Sufian Mohsen for the time. I want to thank him for being with us in Hortman. I want to thank him for his genuine care for his patients and for all of the staff and all of the colleagues. So far we had a great interaction, and to wish him all the best and to invite you to come and meet him in person. He's a great man, a great person, and of course at Hortman we are committed to find the best possible treatment plan or solution, or if just the interaction for you to go out with a smile on your face.
Absolutely. Thank you.
Thank you very much.
Absolutely. My pleasure.